Because if I encounter a certain kind of person, and if I'm talking to you and I sense a level of weakness, um, I get kind of the urge to prey upon that.
This is Dyshae, an individual diagnosed with Antisocial Personality Disorder, aka ASPD or Sociopathy. Socially, sociopathy often takes a back seat to the more sensationalized idea of psychopathy, which is seen as a subtype of ASPD. But unlike psychopathy, ASPD is an official diagnosis. Contrary to popular belief, not all individuals diagnosed with ASPD are violent and detrimental to society. In fact, there are many individuals with ASPD who live normal lives but see the world and those within it differently than ordinary people. Between both the film and the news industries influencing what comes to mind when we hear the word psycho or sociopath, many ordinary individuals live lives knowing and interacting with those with ASPD and are none the wiser. However, although there exists a percentage of sociopaths that are law-abiding and non-violent, the opposite is true as well. Individuals diagnosed with ASPD suffer from impairments in personality surrounding their identity, self-direction, empathy, and intimacy, meaning that their self-esteem is measured based on personal gain, power, or pleasure, all of which inflates their ego. They set goals based on personal gratification without a lack of regard for established rules and/or guidelines, cultural norms, or ethical behavior. They have a genuine lack of regard for the well-being of others, paired with a lack of remorse when inflicting harm. And lastly, they lack the capacity for mutually beneficial relationships, often resorting to deceit and/or coercion in order to achieve their personal goals. Sociopaths often carry out their goals and express their lack of regard through disinhibition and antagonistic traits, and there are 7 in total: irresponsibility, impulsivity, risk-taking, manipulativeness, deceitfulness, callousness, and hostility.
So the way it would work for me is I'll speak to someone. I won't really tell them much about me. They'll tell me about them, and then once they tell me about them, I'll kind of form a personality. I'll exaggerate certain features about my own personality to match what it is that they're looking to see. And then once I get my goal, whatever that goal is, then I'm done with the situation, and then I move on.
To the ordinary individual, one of the most unfortunate things about sociopaths is that you may never know if you're interacting with one, and at the very least, you won't know until it's too late. And even then, you may never draw the conclusion that they're actually a sociopath. You may continue on believing in whatever version of themselves they gave to you, possibly writing them off as an ordinary individual in which whom things didn't work out with platonically and/or romantically. I guess this now begs the question, can you have a relationship with someone diagnosed with ASPD? Simple answer, yes, albeit different than a relationship with an ordinary individual. You see, sociopaths will do whatever they can to achieve their personal goals, even if it means being in a relationship. It's important to remember that everything that a sociopath does is for their own personal gain, and that there's always a conclusion. To an ordinary individual, they may have met the person whom they believe to be their soulmate, but to a sociopath, they've met the person that would help them achieve their own personal goals, and they'll simulate a relationship and be whomever their partner wants them to be in order to achieve them. From superficial charm to direct manipulation, a sociopath will simulate love, but never feel it.
If I want to connect to someone, like in a relationship, for example, if I meet someone that I have an interest in romantically, like I don't like you the same way, like, you know how people like each other. I don't feel any emotional attachment to that. So in order to make someone comfortable and lack of emotional attachment, I have to wear a mask. Like, I have to remind myself to tell my family members I love them. I have to remind myself to maintain in contact with my friends and things like that. So, it can be off-putting, if I'm not exaggerating a bit.
The cause of ASPD is not fully understood. Scientists believe that children born from individuals who have ASPD are predisposed to it genetically. However, since this is a personality disorder and personalities are made up of thoughts, emotions, behaviors, and experiences, it's also believed that it can be developed during childhood, particularly if the child regularly experiences behavior that disregards their rights and or the rights of others, receives poor discipline, and if they have poor role models, all while still developing their personality. While an individual cannot officially be diagnosed with ASPD until the age of 18, typically symptoms can show in childhood, and when they do, a child can be diagnosed with conduct disorder, which is a precursor to ASPD. And approximately 25 to 40% of children and teens diagnosed with conduct disorder will be diagnosed with ASPD. And with this information in mind, it's natural to wonder, can anyone with ASPD be cured? Well, no. Unfortunately, there is no cure by traditional medical standards. While medications can be prescribed to help manage moods, which can help prevent certain behaviors, the best treatment is cognitive behavioral therapy. Since sociopaths often manipulate others and change their caricature, they're taught to use their negative traits in positive ways, ultimately teaching them that their own distorted sense of self-perception creates or has created problems for them throughout their lives. Since sociopaths are calculated and logical, it's beneficial to help them realize that if they want to achieve their personal goals, they may need to treat others better and blend in better within society.
I just feel like it's too much chaos that I'm putting out there in the world, um, and that's really it. I just feel like it's too much chaos, and that's just not a good thing.
Is that something you realized independently, or did therapy help?
I would say therapy definitely helped me realize that, because speaking with my therapist for the 2 years, she helped me realize that a lot of the things I was doing was basically it was all kind of self-serving, um, and at a certain point you do have to gain a level of insight, um, and realize that you're making your own life harder.
Is it hard for you to tune into the emotions of others to a seemingly uncaring and or insensitive degree? Do you have trouble forming long-lasting relationships, platonically and or romantically? Are you not concerned with ethics, morality, cultural and social norms? Are your personal goals always top priority, no matter what? As we've already established, from the perspective of a sociopath, life is morally gray. For most ordinary people, they express one or more of the negative traits that sociopaths do, with the exception being that most ordinary people care about consequences surrounding their identity, self-direction, empathy, and intimacy, all things that someone with ASPD has a lack of regard for. So, what if you've manipulated someone, or have had a lack of empathy in some situations? And what if you are impulsive and self-serving? It's important to understand that it's easy to self-diagnose based on traits that you may share with one of these individuals. But sharing traits with a sociopath does not make you a sociopath. Chances are, you are an ordinary, neurotypical individual.
What was it like before you were so self-aware?
I would say it was very confusing. Very confusing because I didn't quite understand why it was. I didn't feel the way regular people felt. And I would often do things that would be, categorized as sensation chasing. So you would engage in illegal activities, for example, you know, and if you don't get caught, that's quite a rush. It's quite a rush to not get caught doing something. That's things that I used to do, lying and manipulating people. That gave me a sense of power in a way, because I can't necessarily feel anything myself in a way, so it gave me a sense of power to know that I can control other people's feelings.